Now, showcasing all that the Coastal Bend has to offer, it's Coastal Living.
Well, yet again, we've got the doctor in the house, Dr. Alexander. Thank you for having me back.
Great.
Yeah, so head trauma can actually happen a lot more common than you think, whether you get in an accident or even with a fall. But the question is, how can we manage that?
So typically for the best long-term circumstances is to really minimize brain trauma. So basically blood clots can be in different areas and part of the brain. So one's called subdural hematoma below the dura and the brain. And then there's epidural where it's above the dura and the skull. Subdurals will present a little bit later. They can present after 4 to 6 weeks. So it's a slow ooze from the cortical vein from the brain. And then that requires surgery. So typically if you're over a centimeter is usually what we do for surgery. And so we actually remove the piece of skull and we put it in little small metal plates, the same skull back. And again, we usually reserve that to patients who are having symptoms or the size of the subdural. And other things they can cause, like aneurysms can also cause bleeding. That usually requires aneurysm surgery or intravascular coiling. So it depends on the etiology where the problem is. The brain has no sensation. So you might not feel a blood clot. You're not going to, it could present later on weakness, numbness, and those kind of things. It's going to be too late. And so we can also, from a neurosurgery standpoint, we see a severe head trauma. Sometimes we put monitors in the brain and we can decrease the pressure by giving medication, they'll do more surgery, things like that. So typically you go to a major trauma center and then they'll call us what you did.
Thank you so much for that. To learn more information, how can we get in touch with you?
Welcome to call us or go to the ER if you have emergency.
Well, again, Dr. Alexander, thank you for all of your knowledge and be sure to visit us online for more information.
This Coastal Living segment has been paid for by South Texas Brain and Spine.